My kids are grown. There's no need for me to have a relationship with that family because I'm not a part of that family. If anybody needs a relationship, it would be the kids and not me. Fun fact, I've been with my husband for 12 years, and for 12 years, he has been their father. There has never been any bitter, any bad talk, any back and forth. I'm not for sure how you got bitter from me saying that I don't connect with that side of the family. My kids are 22 and 23. And for the last 12, 13 years almost, my husband has been the father that they needed. So I removed myself from an abusive relationship from the guy who signed my kid's birth certificate. There's no bitterness anywhere in my heart. I actually thank God that I went through that because it showed me what I do want, what I don't want, how I want my kids to be raised, the things that I want my kids to have, the memories I want my kids to have. I'm never bitter. So I don't even know what made you feel that you needed to say that. It's always been so funny to me when women say, oh, you bitter, you don't talk to them. No, when you get better and when you do better, I say it like this. When you get a real one, you understand you don't need that fake shit around. I don't look at reality TV, so I have no idea what you're talking about. I don't know. Tell me what they said, but I don't look at any reality TV. First, you're not a bad parent. I never want you to feel like you're a bad parent because you're not. Some things that you can do to get your kid to drink water is find small water bottles. You drink a little bit of it, they're gonna want some. Don't give them the big ones, give them the small ones because they tend to mess over those. And if you feel comfortable, Crystal Light, it makes them think that they're really drinking something that's just flavored water. That's a good way to get water in their system. Also talk with your pediatrician to see if you can do an electrolyte water. You can find a little packets of electrolytes and you can put it in the water so they're always hydrated. That's something else you can do. But kids go by what they see you do. So if they see you drinking a small bottle of water, you know what they're gonna want? A small bottle of water. If not, a cup with ice with a lid on it from a restaurant or something, and makes them think that they're really drinking something and it's just water. You have to trick them. That's it. But they'll try it, and if that doesn't work, hit me up on AskNannyQ.com and we'll come up with some more solutions because we gonna get it. We gonna make sure they get that water. Okay, me personally, I give my babies water once they turn 3 months. Once a week, I give them 2 to 3 ounces of water just so I can rinse their mouth out. Also, take a warm towel and make sure you're wiping the tongue and the sides of the jaws off because you don't want any of that stuff to get stuck in their mouth. It just looks nasty to me. My grandmama always taught me to wipe their mouths out on a consistent basis. One, it keeps the residue out of their mouth and it helps from any bacteria or germs staying in their mouth. So make sure to wipe the mouth out. And yes, warm spring water. If you can do room temperature spring water, do like 2 or 3 ounces, not to substitute for a bottle, but just to make sure you're giving them water. I normally do it around 3 months, and I do it every week or twice a week.
How are you practicing breathing? What are you putting in your body? How is the baby not drowning?
Corey, I'm about to blow your mother-forking mind. I've wanted someone to ask this question. Here are some crazy baby facts that are going to make you appreciate life and babies and how cool they are. So number 1, how are babies swimming in a pool of water? I don't know what's so funny. How are babies swimming in a pool of water for 9 months and their skin doesn't fall off? Babies are covered in a thick substance called vernix. It looks like cheese. It's waxy. It repels water. As they get closer to their due date, this stuff starts to fall off. So if your baby was like past due, your baby might have had like wrinkly skin or their skin started peeling because the vernix started to fall off. How are babies practicing breathing when they're hiccuping? Under your baby's lungs is a muscle called the diaphragm. Hiccups are a spasm of the diaphragm. So what happens is whenever you get a hiccup, And whenever we get hiccups, it sucks air into our lungs really quickly, which is what makes that sound when air passes through our vocal cords. But what happens in babies is it's practicing breathing by expanding its lungs. So it's filling with amniotic fluid, but it's expanding its lungs. So that's how it practices breathing. Next, how does your baby be fine on the inside, not breathing, but fix itself to do what it needs to do on the outside? While your baby is inside of you, there are two vessels. These vessels bypass the lungs because it's getting all of its oxygen from you. When the baby's face hits air, there is a nerve in the face called the trigeminal nerve. That tells the baby, I would like to breathe air now, and it begins to switch its circulation from the umbilical cord to air. It doesn't happen immediately, but it happens over the course of a few minutes. The umbilical cord will continue to pulse. That's a delayed cord clamping, so the baby's starting to breathe air and then also receiving oxygen still from mom. These vessels are called the ductus arteriosus and the foramen ovale. Some people say it differently. But it's just this cute little vessel that just bypasses everything when it doesn't need to be used. When babies come through the birth canal, their chest gets squeezed, which can push out some of the fluid that's in their lungs. That's why sometimes babies who are born via when babies are born via C-section and they don't go through that squeeze, they have a little bit trouble transitioning from being an indoor cat to an outdoor cat because their lungs still have a lot of fluid in it, so sometimes we got to help them out. And I tell my patients who go through C-sections that's very, very normal. But when the baby switches its circulation, those vessels that I talked about begin to close on their own. How crazy is that?
All right, so cradle cap. Cradle cap is frustrating. I'm going to tell you that much. But if you're a breastfeeding mom, what you can do is take your normal shampoo that you use for the baby and use your breast milk that's about to expire or milk that you're not going to use and add it to the shampoo and wash that baby hair with it. You can use it in a bath also for skin irritation. And when you get ready to oil the baby hair, coconut oil. Take a comb, some cotton balls, and comb through that baby hair to get a lot of that cradle cap out. But make sure that you're oiling that baby hair 2 or 3 times a day. It's dry skin. So make sure you're getting all of the scabs and all of that extra stuff out, but moisturize their hair. I mean, take your hands and you're doing the whole scalp treatment. And you're doing it on a regular basis until you see that all the cradle cap is gone. It takes some time. However, stay consistent. Keep doing it. Make sure that every time you think about it, you oil that baby hair. And if your child hair eats up a lot of oil, add olive oil with your coconut oil. Make sure that you're double oil in that hair. Also, talk to a natural hair specialist and a dermatologist to find out if they can give you a natural way to help with the cradle cap. Hey, I haven't. My grandmother and my mom, they would have me wrap the kids in a warm blanket out of the dryer and lick my pinky and stick it in baking soda and put it in the back of each side of their mouths. And normally they stop crying. I don't know what it is about that, but that's something that my mom and grandmother taught me, and it worked every time. So a warm blanket, and you're doing the burrito wrap, like wrapping them real tight in it. And I don't know what it is, but it stops the colic. And if you have any more questions or if that doesn't work, hit me up on AskNannyQ.com and we'll come up with a solution.
What'd you say when the teacher asked if you had a flu shot?
That's a HIPAA violation.
Hey, I have a video on YouTube with questions to ask your nannies when you're doing your interviews. So the link to my YouTube is in my link tree. Check out that video. And if you have any more questions. Hey, beautiful. So I actually did an Amazon storefront and I put everything in there that you guys will need for the body butter. I'm probably going to try to set up some time after the New Year's to do a full video of how to make it also. So give me some. Hey, check my link tree and go to my Amazon storefront. I have a list of a lot of allergy medicines for infants and toddlers that I've used over the years have actually worked. All of that information is on my Amazon.
It depends on how long she done had that fever. Because if she done had that fever longer than an hour, y'all need to go ahead and get to that emergency room. I don't play with fevers because A fever can make you have a seizure. But in the future, you can alternate like Tylenol and Motrin. If not, mine. Go to green alcohol, baby. Put it on a face towel on their chest and put it on their back. And they pull the fever right on out. But I don't play with fevers. I'm checking your temp every 15 minutes to make sure you ain't over here about to seize out on me. You can let them play in the shower. See if the temperature go down like that. But if that temperature ain't going down like it needs to, go ahead and get to that emergency room. I don't play with nothing about no fever. But that's the best thing. That green alcohol, it pulls the fever out every time. But keep me updated on that, baby. Because fevers ain't nothing to play with. Yeah, I want to laugh. I forgot all about this. So Max was a lead teacher in the classroom that I was in. We only worked together for a few months before the center was closed down by the FBI. How? The owner of the daycare was allowing 4 parents to use the center's kitchen after hours for extracurricular activities to help them with their street pharmacy job. So it was so funny because the director had been saying little stuff about, I'm always seeing your car up here on Saturday. I wonder what's that about. And the parents would be like, oh, we just be up here cleaning and helping out the owner. And she was like, Baby, they text us on a Monday. And Max texted me and was like, girl, why we all just got fired on our day off? Close that center down fast. Now, let's rewind. We were doing show and tell. That baby, Tim, came in and he was like, did me daddy pump it up? Him pump it up, and me must say him last all night. Cause that was her told me a TT, Miss Max. That me daddy use him pump, and him can pump it, and him go like a rabbit. So me must like the pump. It's for your balls, okay? This is my ball pump. It's not a ball pump, but okay. All right, go ahead, put that back in your book bag. Yay! Shelly brought out a leather mask. If you know, you know. The mask had the mouth cut out of it, and it was red right here. And it had the eyes cut out of it. Me and Max was like, she was like, "Didn't me scared with mask, cause it got the red lips." Raw. We was like, "Oh my God." She said, "I couldn't find a whip to go with it, cause it's a whip to go to the mask. Cause when me mom put her mask on, my daddy said it's time to pump it up. And him and them, they go in their playroom, cause we can't go in their playroom. It's just their playroom. That's it. Okay, I go put it up." We were like, so I think when Max talked to the parents, they were like, "Oh my God, I am so sorry that this happened." They didn't care, but I forgot about all of this. It's so good to hear from her though. Max was an amazing teacher then, but she was a retired school teacher that came into daycare setting. But she was cool. That's awesome. I forgot about all of this.
No, my IG is AskNannyQ. I haven't had any problems with anything on it. I've been able to post and do stuff. Now you're going to have me go look. I'm sorry I didn't see your comment. In the future, please hit me up on AskNannyQ.com. But I did do a video on this because somebody else hit me up on AskNannyQ.com, and I did a video for them. It's on my YouTube. The information for my YouTube is in my bio, in my link tree. If any of those things don't work, please hit me up so we can come up with a solution together. So anytime your child is giving you a sign that they're ready for party training, no matter what age they are, go ahead and do it. They're trying to help you out a little bit. So no matter what age they are, if they like, hey, I want to sit on a pot, allow them that. Don't stop it because you feel like they're not old enough. Allow them to go ahead and do it. I tell parents now, when you see a baby wanting to walk and they're 6 and 7 months, let them walk. Don't hold them back because you feel like they're not ready. Remember, that's their own little person. They have their own little feelings, their own little everything. So allow them to be adventurous. Allow them to, step out there and do things. I am all for a child saying or doing something and, you're like, wait a minute, you're too young to be doing that. I encourage it. So if the baby's, hiding in the corner like they normally do when they're ready for potty training or they got to do the number 2, it's time to go ahead and get their potty training ready. And I have a video on YouTube that has a lot of helpful tips for potty training.
This filter turns you into a celebrity, so who am I getting? No.
Look, so probably 6 months before the baby turns 2, when I go to the doctor appointments with the parents, because I do go to the doctor appointments with the parents, I need to be able to say also blah, 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 so mom and dad can advocate for themselves. That's really what I be doing. We also had a question about blah, 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 blah. Y'all know how I am. I feel like I'm everybody's mama. So I be in there like, talk up. Shit. Come on. Let's ask these questions. We didn't wait in that waiting room for an hour. Come on. But I always ask the pediatrician about multivitamins. We're getting ready for school, so we want to make sure their system is good. Is it okay if we give multivitamins, blah, blah, blah? Most pediatricians are like, yeah. I only had like 2 pediatricians that were like, let me do some blood work so I can see what's missing and what we can boost. And that was so amazing to me. I was like, oh, I like them. I like them a lot. So I try to make sure that I get the child's system ready because it's a lot coming. You got kids that don't bathe on a regular basis. You got kids that have pets. Your child might be allergic to cats or dogs or hamsters. And you have kids that have all of that coming to the school. You also have kids that parents give them medicine in the parking lot and send them to school anyway. So those germs are at school. You have kids who are just now finishing their antibiotics and mom didn't tell anybody they were sick. You got all of those germs too. So this is why it is so important that as soon as you get home from daycare, you take everything off. You wiping their faces, you spraying down the car seats on a regular basis. That's why I always would use like On Guard. It's a link in my essence oils. It's called On Guard. I would spray that on their car seats. I had ordered like a box of the wipes. Soon as you come out that daycare, baby, I'm wiping that face down and wiping them hands down because, yeah, I already done sprayed your car seat. And when you get out the car, I'm spraying it again because I got to get back in it. So whatever is in there, I need to kill it. That's why my babies was stripped down at the door. Come on, let's take these clothes off. Let's get into our play clothes. When I tell y'all, it took me a while to get my babies on that kind of schedule, but it was so worth it because I noticed that the ear infections went down. I noticed that they didn't have the sniffles so much. Like, I have babies that stay with ear infections because they had bad sinuses and allergies, so I was always OD with, oh, we're going out. Okay, as soon as we get to the car, they know I got to wipe their face in their hands. Like, I made sure that they understood this is what we do on a regular to make sure we always feel good. So even if I'm not around, they still want to wash their hands all the time. They still want to make sure that they're taking their clothes off and putting them in the washroom because they know it makes them feel better. And after a while, you kind of notice, like, okay, they're really not getting sick that often. Okay, let's keep doing it. Okay, the multivitamins are doing good. So I just be trying to prepare them as much as I can to get to preschool. Because I don't know what kind of germs are in the school, but baby, them things, they on steroids. And when they get sick and they bring that back, I just be trying to do my part. That's it.
Hey, so I know a lot of daycares ask that you bring in things when you're doing a lot of substitution, especially if your child has a lot of allergies. But bring it in. They will make sure that your child eats it, especially when you're on a certain diet or they're on a certain diet. It's just easier to make sure that you pack the breakfast, the lunch, and a snack. And the daycare must give it to them. And they also have to put up a list of what your child is allergic to, what they can have and what they can't have, just so when they have parties and stuff that the child isn't given something that is on that list. Make sure you have everything printed out and give it to the center. But it's easy just to bring everything in that you feel that your child is going to need every day. That way it's not a, oh, I didn't know, we didn't have it. Everything is covered on your end and on their end.